With this, we open the floor to questions, and of course, I would like to invite questions to our.
We are asking actually China to be transparent, open, and cooperate, especially on the information raw data that we asked for at the early days of the pandemic. And we will be discussing with member states on the phase 2, and hope member states will help in guiding to address the challenges that I have already underlined among other things.
A special guest here today. First, and I see first here on.
As you know, we have done the phase 1, and the phase 1 have shown some progress, but there are also some challenges that has to be addressed. And one of the challenges is what you mentioned, access to raw data, especially the data at the start of the pandemic. The raw data was not shared.
Andreas Rinke from Reuters, please. Please unmute yourself.
There was a premature push to, especially reduce one of the options, like the lab theory. As you know, I was a lab technician myself. I'm an immunologist, and I have worked in the lab. And lab accidents happen. It's common. I have seen it happening, and I myself had errors. So it can happen.
Andreas Rinke from Reuters. I have one question to the General Director, please.
And we need information, direct information on what the situation of these labs was before and at the start of the pandemic. Then if we get full information, we can exclude that. So one of the challenges, again, is, a challenge of access and also transparency with regard to the hypotheses that are put.
Mr. Spahn just mentioned that he wants the further investigation of the origins of.
I think we owe it to the millions who suffered and to the millions who died really to understand what happened. And I hope there will be better cooperation. And we have continued the engagement with China and also with member states.
Of the part of Chinese government to do so. Und Herr Spahn, an Sie eine Frage. Sie haben.
We do appreciate the cooperation of the Chinese government so far for the first mission, but that's not yet enough, obviously. Like the G7 leaders called on more investigations, we fully support this, and so we can just call on China to intensify the cooperation to examine the origin of this virus, to learn for the future, but as Tedros just said, we owe it to the people.
Welchem Wege das dann sein wird, durch COVAX oder durch bilaterale Verträge?
We look forward to working with our Chinese counterparts on that process, and the Director General will outline measures to member states, I believe, Katharina, tomorrow, on Friday. Tomorrow is Friday, I lose track of the days around here. In order to create a more stable and predictable process moving forward as we seek the answers that the Director General has laid out.
Tedros Adhanom Ghebreyesus, WHO Director General. We have Dr. Katharina Böhm.
Wir werden heute zeichnen eine Vereinbarung zwischen der WHO und der Bundesrepublik Deutschland, dass Deutschland 260 Millionen Euro im Rahmen der Unterstützung konkret für die Weltgesundheitsorganisation, für die WHO bereitstellen wird, um damit die Entwicklung, Herstellung und Verteilung von Covid-19 Test-, Behandlungsmethoden, Therapeutika und vor allem auch Impfstoffen zu unterstützen. Als Deutschland haben wir uns zudem verpflichtet, mindestens 30 Millionen Impfdosen über COVAX an Drittstaaten zu geben.
Deutschland wahrscheinlich mehr als die 30 Millionen Impfdosen spenden wird für andere Staaten.